Hello doctors, and I will be telling you today which one to choose between now MD, MS or DNB in this year or any year NEET PG exam. So what to choose now? So what you have heard is DNB is equivalent to MD, MS nowadays, but still there are some differences, and I'm going to highlight these differences for you. So firstly, I will be highlighting some advantages of DNB. So advantages are, first one, it is not that expensive. So as we compare the amount of fees of a MD, MS course in a private college, DNB fees is quite low as we compare that. So for example, the MD, MS course in a private medical college range from 13 lakhs, 12 lakhs, 13 lakhs per year to 30 or 40 lakhs per year, whereas in DNB it ranges from 75 to 1 lakh per year. So a great difference is there. Now, easily available at lower ranks. Now this is an important point, because as toppers and every student like you have very first priority for a MD, MS seat in a college, in a government college. But so by this what happens, the DNB seats are easily available at lower ranks like 8,000 to 15,000. It will be easily available to you. So this is a benefit, and it is also nearby equivalent to MD and MS seats. So now interaction with the some latest procedures. What happens that DNB occurs in some good private hospitals, private institutions, and what this private institutions, what they do, they are equipped with expensive investigations, new surgical technologies, and many, you can say, expensive instruments, and like machines, new machines that helps in learning more latest procedures. Whereas government medical colleges or private medical colleges, they are not that updated. So this is also a benefit. Now recognition abroad. Now many of you might be opting for practicing in abroad. So I must say go for DNB, because now foreign countries also have started recognizing DNB from India more than MD, MS. Yeah, they know that the DNB doctors are more skilled and they have worked a lot more, they have handled more cases, so they are more much experienced than the MD, MS. Like, so these are, they are opting DNB first, then after that more than MD, MS seats. So this recognition abroad is also a benefit for if you choose DNB. Note one important point I want to say here. Note it down. Like DNB, it is not recognized as a degree. It is not a degree, but it is recognized as a specialty work experience. So this is a myth. Some uh, some students say that it is a degree, but no, it is not a degree. It is recognized as a specialized work experience. Now some disadvantages I will be highlighting of DNB. Why should you don't take DNB? So the first one is a very low pass rate. This is the major issue for students who fear to take DNB courses, because the pass rate is very low. 15 to 20% only. This is true, with the bitter truth of DNB, that it is a very low pass rate. Now less exposure, because what happens, there are a lot of seats in DNB, around 6 to 8,000 seats in DNB institutes, but the not every institute is up to the mark. Like for example, Sir Gangaram Hospital in New Delhi is well equipped. It is a great hospital to practice DNB if any branch. But if you take any in periphery hospital which is opting DNB seat, but it is might be not getting that much exposure to cases, patients, and the latest procedures which I talked earlier about the benefits of DNB. So this is one of the drawback, I can say. Now the other thing, problem in the community, because if you opt after completing DNB. If you are for a private practice, you open your clinic, your private clinic, what happens that there is less recognition of the DNB degree by the general public. What they think that it is a diploma, it is not that specialist and all. So it is a big problem in general public. If you open a private practice, private clinic, you offer a private practice, so public not easily recognize what is DNB, and they better know that MDMS is the only specialist and not DNB. So this is a big difference. Now jobs, many of them the students are opting for jobs in medical colleges as well, because now they demand some medical college they demand 3 years or more work experience, like from a DNB degree holder, whereas while if you are a MDMS degree holder, you have no such condition to have a job. You have to practice for that in a medical college. So they, if you are opting for it, I will say don't go for DNB. So what's the conclusion in this? What should you choose in that counseling if you opt for? So I will suggest go for a MD/MS degree as your very first priority, and after then if you have no options for the left and if you are not willing to prepare again, now then only you should take DNB degree. And if you are preparing willing to prepare again for the next year, I will say don't take DNB and give yourself one more chance and get this MDMS government seat, because if you are opting a job, as I said earlier, you have to do 3 works and 3 year work experience. This is a lot more time, but what happens if you will invest 1 year in preparation, that will get you a MD/MS degree. So I will say your first priority should be that MD/MS government seat, and after that if you are uh, eligible, you can take MD/MS private seat, you should opt for. And after that, what if you have no options, you don't want to prepare for the next and you are getting a DNB seat, go for a DNB seat. And or if you want to practice abroad, then you should take the DNB seat. So this is my conclusion over this. Hope you like it. Any other doubts, you can